We're broadcasting from the Middle Tennessee Electric Studios. Visit MTE.com. MTE.com. Middle Tennessee Electric, serving to make life better since 1936.
This is the WGNS Action Line, talking with Rutherford County newsmakers about what matters most to you. Now, your host, Scott Walker.
Joining us by phone this morning, Dr. Craig McCabe, local eye doctor here in Murfreesboro. Dr. McCabe, how are you?
Hey, I'm doing great, Scott. How are you all doing?
I am doing good, and thankful the weather is nice these next couple of days.
Yeah, I'll tell you, you can tell when spring is starting to come is when the nighttime lows start rising up into the upper 40s, lower 50s.
I prefer that 70-degree weather that we have throughout the day. If we could have that every day, wouldn't it be perfect?
You got to go move to San Diego.
Yeah, I guess so. You know, it's also that time of year where folks have allergy problems, and allergies are already starting to wreak havoc on a lot of people. I'm sure you've already had a few patients yourself about this.
Yeah. You know what I did this weekend that I've never done before? I became the first person in the neighborhood to start mowing their yard.
I haven't seen anybody mowing yet.
Yeah, I think they'll all start later this week because later this week, the highs start getting up into the low 70s.
Yeah,
so nice.
It'll be really nice, almost up to 80 by the end of the week. So that's great news. But with you mowing, did you kick up a lot of dust? Did you have a lot of allergy problems, runny eyes, all that good stuff?
You know, that's right. I typically think of allergy season starting for people that have seasonal allergies when the Bradford pears drop their blooms. To me, that's kind of the official start. But, you know, the buttercups and the daffodils, they have all bloomed. And the Bradford pears are budding out. I wouldn't be surprised if they don't come out in the next week. Yes, allergy season always starts in March. And what I do and what I'd suggest other people do that have to deal with it is they take their allergy medicine before they go out and work in the yard. So if all you get is the conjunctivitis, the red, itchy, watery eyes, then you can use an over-the-counter, actually, allergy eye drop. There's one called Pataday that used to be prescription and is now over-the-counter. And I really think that that does the best job of all the over-the-counter ones out there. You get the extra strength one with a green label, and it's just one drop in each eye in the morning. If you don't think you're going to be outside all day or something like that, but then you're going to go out and work in the yard, you put it in 15 minutes before you go out, and you're covered. Now, if you need something for your sinuses, then I appreciate the nasal inhalers. There's one over the counter that's a steroid, Flonase, and then there's another one that's only prescription. That's an antihistamine. But those two together are a great combination, and they even make a prescription one that's got both in one, so it's just one shot up your nose each morning. And that will make a world of difference to those people that suffer from allergies.
What if you do something like combine not only the Nasonex type spray, but also one of those pills like Allegra, Claritin? Can you do that?
Yes, you can. Those are antihistamines as well. But as you know, you swallow them, they go into your stomach, they get absorbed there. Then they got to travel all throughout your body to get up to your sinuses where they need to be. So you consume a higher dose, you have more risk of side effects rather than a nasal inhaler, which puts the medicine right where it needs to be.
So if you start the nasal inhaler, how long does that take to really start to be effective? I mean, can you tell a difference that first day, the second day?
So it depends on which one. The steroids typically take a few days, and the antihistamines in a nasal inhaler will work in about first hour. Yeah, the Pataday, like I said, the eye drop, that will work in the first 15 minutes. And it does a little bit for your sinuses, but again, not as much as the nasal inhalers. And if you have really bad allergies, then you should do both. Hopefully that'll take care of it. If it doesn't, then you've got to consider getting the immunotolerance shots, those allergy shots. So it just depends upon where you are in that spectrum as to what you need.
I'm glad you said that about the shots, because as you were talking, we got a text asking about the shots. It says here, a friend of mine gets some type of allergy shot each week. Is that something that is readily available? Is it safe? And what is it? First of all, are those shots weekly or are they daily?
They're weekly, and you'll have an allergy test called a time test done at an allergist's office, and they'll find out what you're allergic to, and then they will concoct a mixture that they inject into your arm once a week, and it makes your body less sensitive to those allergens, or it induces tolerance. And they're helpful when these other things don't help.
Okay, cool. Here's another text question. And by the way, folks can text us any type of question they'd like at 615-893-1450. This person says, I just started a new job, and the company I work for has Cigna health insurance that also includes eye or vision insurance. Is Cigna something you take? And I've never had vision insurance. How in the world does this work?
Yeah, so you know what? That's actually a pertinent question, because a lot of people do not understand the differences between their medical insurance and if they have a vision rider plan as part of their insurance, such as Spectera, iMed, VSP, or the one that this person has. And within those, there are a few different plans, just like Blue Cross Blue Shield has like over 40 different plans. And so, we take most all of them, but not exactly all of them. And what you have to do is you have to call up your physician's office and you give them your information on your insurance card, and they can look it up and see what's covered and what's not. But if we were to talk about it in overall terms, in general, medical insurance, as far as outpatient, covers any medically related diagnoses, all right? And vision insurance is only vision ones for glasses and contacts. Some of them will also cover a basic exam. A lot of them, though, do not cover for an annual diabetic eye exam, but that should go under your medical. So if you have them both, then typically what one does not cover, the other one does. But if you just think of it kind of like vision is for contacts and glasses and the refraction fee, those kind of things help giving you a discount on your glasses and contacts, and then medical is for everything else, then you'd be pretty correct. But the one kicker in these two insurances is they don't play well together. You cannot use both of them on what's called the same date of service. So you can't go into the doctor's office and expect to get treated for some medical eye problem and then also be able to use your vision insurance. You can use one or the other. And then the last thing you should know on your vision insurance is that some of them restrict what they will pay for you on either a calendar or a 12-month basis. And so that's a little confusing. So some people, their benefits will run January 1 to December 31st. That's the calendar. And then other people, it's 12 months since they last used their vision insurance. So if you last used it in June and now it is March, you can't use it until June rolls around again. So all you have to do is take your card, go to the website, plug in your member number, and they'll tell you which way your insurance works. Does that make sense?
It does make sense. And I'm sure, I could see where it could be confusing, especially because of the whole date thing. But yeah, that makes sense. I'm curious.
Some people, they just want to make one trip to the eye doctor's office and get it all done. But medical things and vision things, have to be done on different appointments, different dates of service if you need to use both.
I get it. Yeah. And so I'm curious, do the majority of folks out there, like your patients, do they have vision insurance or do the majority not have it?
The majority do not, but probably 35-40% do. And it's becoming a larger margin. I think they're more popular in people over 65 as a supplemental to their, or it's an addition to their Medicare supplement or their Medicare substitute insurance, United Healthcare, those others. And then some people that are not of Medicare age, they will buy a vision rider onto their regular medical insurance, and you can get it that way as well.
So vision insurance as a whole, if you get this extra added on to your regular health insurance plan, it probably is not very expensive if you go that route. But I'm sure if you don't have traditional health insurance, then it would be expensive if you just got vision. But who would do that, of course?
If you've got glasses or contacts, it's probably worth doing because you're going to use the benefits. But if you don't, or you don't see the eye doctor every year, it's probably not worth paying for.
Gotcha. Now, how often should you get a new prescription for eyeglasses or for contacts?
Another good question. So both those prescriptions, like any other prescription in the state of Tennessee, are only good for 1 year. So if you want to get a new pair of glasses and it's been more than a year, you got to go get a new prescription. Same things with contacts. They're considered medical devices and they're regulated by the state that way. However, if you are, say, past the age of 60, your prescription doesn't change much until your cataracts start to bother you. And then they change pretty quickly. But there's a period there where you don't. I'd say when you're young and you don't need any glasses, through high school probably, you don't need to get glasses that often except when you're growing and the size of your face changes. Another time when glass prescription changes a lot is from 45 to 55. And it's not the distance vision that really changes, it's the bifocal strength that goes up every couple years. So I would say overall, if you wear glasses and you don't see as well as you should, then yeah, it's time to go get that checked. It's either you need a new prescription or something else, and you'll be glad either way you spent the time. But if you see just fine with your glasses and you take great care of them, like I say, when they're not on your face, they should be in their case. Then they won't get scratched up. If the different coatings aren't delaminating off the lens, then you can go another year or two.
Here's an interesting question we just got via text. It says, I am 32 and have a second job on Thursday, Friday, and Saturday nights in Nashville at a small bar where they allow smoking. And every night I leave with my eyes burning and hurting, something awful. I'm curious, could you be allergic to cigarette smoke? And can your eyes show an allergy like that?
Absolutely. Your lungs and your bronchial tubes can have a significant reaction. There are people that can't stand to be around smoke. They have to run away from it. It'll make them choke. It'll make them gag. They will have a significant allergic reaction to it. What's that song, Smoke Gets in Your Eyes? Well, it's a chemical irritant as well. And if you have other issues going on with your eyes, for example, a dry eye problem would be most common, or something called blepharitis. If you wear contacts that can dry out your eyes, you're going to have more of a problem with smoke. And I would say that that's a common issue, not uncommon. But if you go see an eye care doctor that specializes in treating dry eyes and things like that, then they can often take care of you easily. And lots of times that care will go to your medical insurance, as we talked about.
Are there any long-term negative impacts that allergies in general can cause if you don't get away from that source of the allergy?
Besides just making your life hell?
Besides that.
So it's a spectrum once again. Some people are not affected. Some people are affected very significantly. Peanut allergies have the same thing. Some people a little, some people a lot. It depends where you are on that curve. And it also depends upon how you take care of it. Some people, they only need to just try to avoid the irritant, which sometimes is harder than others. And some people have to take the allergy medicine, have to get the immunotolerant injections, and still have issues with it. So it depends where you are there, but the more significantly you have it, the more it'll affect other things. People with mild allergies, it typically doesn't affect their eyes, but people with moderate to severe, their eyes will be red all day long. And I guess as far as pathology goes, if you have a poor tear film, then a bad dry eye problem compounded with allergic conjunctivitis can give you some issues, even leading in a severe form to what's called corneal ulcers. So there's all different kinds of allergies along the spectrum, and thankfully most people do not have the severe form.
I remember last year, probably around this time, we got a phone call or either a text from somebody who was saying that their eyes are so red and often runny that they actually feel embarrassed to go out in public because they said it looks like I'm hungover all the time. It's so bad.
Yes, exactly. So let me make another recommendation to people. There's an over-the-counter drop called Lumify, Lumify, and this is the safest, best drop for getting redness out of your eyes. It's over the counter. So that works very well, but you should not rely on that to be a medicine for you all the time. Instead, you should see your eye care doctor and let them treat the underlying cause to get rid of the problem. The Lumify treats the symptom, redness, not the problem. So when you treat the problem, you can fix it for a long time. The Lumify just works for about 6-7 hours, but it works very well.
I was looking at the 15-day allergy forecast for our area here in Rutherford County, and it looks like we're kind of between that moderate and high level for tree pollen. Today, tree pollen very high. Tomorrow, it's considered moderate. And then on the 12th, it goes back to high again.
Yeah, I think the Bradford pears are going to start blooming today, now that I take a look at them. And when they drop their blossoms, besides I don't know what you want to call it, but a specific smell that they have when they do that. But when they drop those blossoms, they drop the pollen, and boy, people really know it's allergy season. So what you should do today is start preparing yourself. Go out, get these allergy medicines if you suffer from allergies. If you suffer more than just a little bit, make an appointment with your eye care doctor or your allergist. Get these things taken care of before they become a significant problem and decrease your ability to have a good time and a good life, which is so important. So we have great medicines out now. You don't have to suffer from it.
I've heard some people actually move away from places like Tennessee to avoid allergies. I mean, they have them that bad year round.
Yeah, but we're in this kind of Tennessee, Ohio, River Valley area, which has a lot of pollens of certain types. You can go out to the desert. They don't have these pollens at all, right? No deciduous trees out there and hardly any grass, right? But they have their own pollens out there. So everywhere you go, unless you're going to one of the poles or something, there is all kinds of allergens and pollens. And it just depends upon, once again, because you're allergic to one doesn't mean you're allergic to all of them. And some people have it so bad, they've tried all these things, and they say, gosh, we've been thinking about moving somewhere else or scaling down or whatever it is. And they say, let's just go to a place where I don't suffer from these allergies. And then lots of times they get there and they suffer from the allergies and the pollens that they have in those areas. So before you do that, go live there in an extended stay for a few weeks. And I'll tell you one last thing that's really interesting about allergies is the first time you're exposed to that pollen, you're not allergic at all.
Really?
Roll around in it and you wouldn't be allergic. But then your body develops these IgE antibodies, which are the allergen antibodies. And then the next time you are exposed to it a month apart, then you'll have a significant acute allergy reaction to it.
And of course, there's some areas, obviously, Tennessee being one of them, I would say, that you definitely have allergies as far as pollen and stuff go, much worse than other areas. I see here they put out a list of those different cities that are the top 20 allergy capitals each year. But it is fascinating, though, how allergies can get much worse in some areas.
Yeah, and we would be remiss to neglect half of the people with allergies, because only half of the people with allergies have seasonal allergies, and the other half of the people with allergies have, perennial allergies, annual allergies. They're all year long, all 12 months, not just spring and fall. And that's because they're allergic to more than just tree, grass pollen. They are allergic to dust, cat and dog dander. And often when I see these people in the office, they come see me and I'll say, it's the middle of winter or something. I'll say, you have allergic conjunctivitis. And she says, well, there's no anything blooming or no grass growing or anything like that. And they'll say, how can that be? And I say, well, do you have a dog or a cat? Oh, yeah. I've got the cutest dog you've ever seen. They'll go into that, and it turns out they're allergic to their dog. But you know what? They will suffer before they get rid of that pollen. It just depends upon what you tolerate and how much you care about it.
Yeah, I hate that for folks who have an animal, then turns out they're allergic to that poor dog, poor cat. But yeah, I've heard of that happening. Mm-hmm. By the way, Nashville, it says Nashville Metro Statistical Area, which includes Murfreesboro and Rutherford County. We're listed at number 32 on the list for being one of the allergy capitals across the nation. Number 32.
Well, that's better than I would expect, because we're usually in the top 10 in things you don't want to be, in the bottom 10 and the things you do want to be up in. So I'm glad to hear we're not so bad in that one. But tell us, who are the big three, just for our listeners out there?
Well, it looks like number one for the worst allergies, Wichita, Kansas. And then number two, this surprised me, Virginia Beach, Virginia. Then number three, Greenville, South Carolina.
Right. And so all those places are in different geographical locations, whether it be mountains to the sea, and they can be the biggest places in the country for allergens, and they all have different pollens. So see, that's why you got to be careful if you're a significant allergy sufferer where you live.
Yeah, because this list is quite long. It looks like no matter where you live, you could run the risk of having some bad seasonal allergies if you have allergies already in Tennessee. Mm-hmm. So anyway.
You're right. Yeah. But you know what? The bottom line is there's lots of good medications. Give the over-the-counter ones a try. Go out and get some of those today, because I'm telling you, the Bradford pears are going to come out today, and get ready for it and protect yourself, and you can deal with it. And if it's more than what the over-the-counters can take care of, go see your doctor and they'll take care of it for you.
That sounds good. We're going to take a short break right now, but on the air with us, we have Dr. Craig McCabe, local eye doctor here in Murfreesboro. And he is at 122 Heritage Park Drive in the borough, directly off Memorial Boulevard. Again, we're going to take a short break and then we'll be right back. You're tuned to the Action Line on WGNS.
the Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Hi, this is Amanda from Animal City. Come do business with my family. You'll find us at 919 Northwest Broad Street right here in Murfreesboro. As your local pet store, we're here to build relationships. That's just one of the reasons that we've been a staple of the Murfreesboro community for more than 34 years. Come see why Animal City is the trusted choice for pet owners all across town. Visit us today at 919 Northwest Broad Street in Murfreesboro. You can also find us on Instagram at Animal City TN.
Hi, I'm Larry Castelli, and I love living at Adams Place. I do exercise. I go 3 times a week. I go to stretch and balance, always conscious of your needs. It's not that someone is telling you what to do, it's they're looking out for you. It's a good workout.
And what about the food?
Oh, give me a break. There's so much food here. I would highly recommend Adams Place.
In today's changing world, you need a financial planner that you're comfortable with. Rely on the bonds that you've built with trusted friends at Old National Bank on Dr. Martin Luther King Jr. Boulevard here in the borough. And if you just moved here, visit us and enjoy warm, homemade cookies.
Honey, the cookies are ready.
Like Grandma used to make. Old National Bank. We're better together.
2230 Dr. MLK Jr. Boulevard. Old National Bank, member FDIC.
Middle Point Landfill's Mike Klassen.
Between our property and the county landfill property, there are 1,000 contiguous acres that doesn't exist anywhere else in this county. And what an opportunity to do something big there. And we as Republic, as part of this long-term 50-year vision, are saying we will pay for and work with the county on building any number of recycling programs.
The answer's here.
We are ready to do something big there.
Middle Point Landfill.
This is the WGNS Action Line.
To bring you today's interview, here is Scott Walker.
We have Dr. Craig McCabe on the air with us this morning. Dr. McCabe, we've been talking about allergies. Do you see a lot of patients with allergies this time of year?
Oh, yeah, probably 15% see during the day. I would say, it peaks out probably end of March, but it's gonna start coming on now for the seasonal allergy people.
But again, the good news, if you start taking medication, start using the eye drops and nasal sprays early enough, then you're going to be able to hopefully get through the allergy season and then throughout the summer as well without any problems.
Yeah, it's like a stitch in time saves 9. So all these medicines work better if you take them before you get exposed to the allergy or the pollen than when your eyes are real red and your nose is running and your eyes are running and you're coughing and sneezing. So it's much easier to take care of it ahead of time than during an actual attack of it. So just keep that in mind, and it takes less than a minute to take care of in the morning, and you'll enjoy your day more.
And we have a question, by the way, and our phone number, if you want to text us any questions, 615-893-1450. Again, 615-893-1450. And the question is, my eyelids seem to twitch almost on a daily basis, a few times a day. Why is this happening to me?
Scott, can you tell me the difference between a wink and a blink?
Well, a blink you do without thinking about it, and a wink you actually have to think about it and, I guess, control your muscles to make yourself blink, or to make yourself wink, rather.
That's true. And if you think about it, a wink is with one eye and a blink is with two. Yeah. So if both of your eyes are having this spasm, this uncoordinated involuntary contraction of the orbicularis oculi muscle, the muscle that causes that squeezing of your eyes together, if both of them do that, then that is typically either from some kind of significant eye irritation, dry eye, or often commonly called blepharospasm. And this will go on pretty much constantly, but it'll get worse when your eyes are dry or you're tired or your eyes are tired. Now, you can have a hemifacial spasm, which is where just one eye will squeeze or twitch, but it will typically affect the lower face, like the corner of your mouth will jiggle and come up too on the same side. And then there is a very mild spasm of one eye, and it's usually the lower eyelid, and that's called myokymia, myokymia, and that is due to an irritation from dryness, lack of sleep, increased stress in your life more than normal, or a combination. I used to get this whenever I was in school decades ago when it was final exam week. It's common. That's probably the most common one. But these all have good, easy treatment. And if you go see your eye care doctor, they can help you with them. But that's absolutely very treatable.
We have another question here, and again, our number is 615-893-1450. This person says, last month, I had bleeding in my eye. It was almost as if a blood vessel or several blood vessels broke, and I already had a doctor's appointment scheduled, and I went, and the doctor said it's nothing to worry about and quickly moved on. And I thought nothing of it, but then it happened again this week. Is this something to worry about?
Well, they're no fun. They make you look like you got punched in the eye or something bad's happened to your eye. Now, the doctor should look inside your eye, do a dilated eye exam, and make sure there's no problems causing it inside the eye. But if it is just a subconjunctival capillary, one of those fine little red blood vessels in the white part of our eye, if you rub your eye a lot, if you're coughing or sneezing hard, bearing down hard, if you're lifting heavy weights, those can all cause those little capillaries from increased pressure. They're really fine and delicate to break open and bleed a little bit. But now if you're on a blood thinner, aspirin, ibuprofen, or one of the prescription ones, then you're going to bleed a lot. And it may, some people goes all the way around 360 around their eyeball. So you should find out what's causing it and stop doing it. And you'll find that these little subconjunctival hemorrhages, as they're called, won't happen anymore.
So they look scary, but often are not as scary as they look.
Right. They're usually not. But in any history of any kind of trauma or anything like that to the eyes, it could be a symptom or a sign of something more important. And so you can't always just blow them off, so to speak. But without any trauma, anything like that, then it's typically this minor cosmetic problem.
Here's another question. It says, my right eye itches like crazy, and it's kind of reddish color. And this has been going on since the start of the weekend. Is there a chance I could have pink eye? And if so, could that be only in one eye?
Yes. And about 60% of people with pink eye will rub their affected eye and then rub the other eye and cross-contaminate the two eyes, and then they'll get it in the other one. It won't be quite as bad, but they'll get it in both. And pink eye, anyone will tell you that's had it, is no fun at all. It's kind of miserable, and you can't wait till it goes away. We have some good treatments for it in our office, and it's very contagious. That's the other thing about pink eye. That's why you shouldn't go to work, shouldn't go to school, and you should try to get treated for it as soon as you can.
You know, people are not rubbing each other's eyes, so how does it spread?
Okay, so good question. Hand to eye, and then hand to another eye. So you can shake hands, you can grab the same doorknob. These viruses can live on hard surfaces, we know this from COVID and others, for several days. And so I tell people that once they have pink eye, and we've got tests to see if it is pink eye or something else in our office, it's a rapid test, then you need to just wash everything in your house and wipe down all the counters, just like if somebody had COVID. And you don't want to share anything because it's so contagious.
So be careful. Again, talking to Dr. Craig McCabe this morning, and he is at 122 Heritage Park Drive in Murfreesboro and online at McCabeVisionCenter.com. I know we only have about a minute or so left, So what is some good information to close with?
Well, I would say enjoy your life much as possible. Get out, enjoy the nice weather, go for walks, work out in the yard, but protect yourself if you suffer from allergies. Working in the yard, wear at least some sunglasses, but some kind of protective eyewear so that you don't get something in your eye. That's something else that we see a lot that can be a problem. And if you haven't had an eye exam in a couple of years, if you got a family history of eye disease or you're having any problems, then make an appointment and we'll take good care of you.
Sounds great. Again, Dr. Craig McCabe on the air with us. Dr. McCabe, thank you for joining us.
Thank you, and I hope everybody enjoys the nice weather.
You've been listening to Dr. Craig McCabe with McCabe Vision Center. McCabe Vision Center is in Murfreesboro at 122 Heritage Park Drive. Find McCabe Vision Center online at McCabeVisionCenter.com. You're tuned to WGNS, your trusted source for local news and more since 1947.